I'm going to do a reading from Medical Herbalism, Science and Practice of Herbal Medicine by David Hoffmann, published in 2003. This is from the Digestive System chapter, and it's on peptic ulcers, a circumscribed ulceration of the mucous membrane penetrating through the muscularis mucosa and occurring in areas exposed to acid and pepsin. That's the definition from the Merck manual. Ulcerative conditions of the stomach, duodenum, and esophagus are very common in our society, and non-prescription medicines for symptom relief are major moneymakers for the pharmaceutical industry. Gastric ulcers occur along the lesser curvature of the stomach, while duodenal ulcers are found in the first few centimeters of the duodenum or the first part of the small intestine. Drug treatment for ulcers aims primarily to reduce the corrosive impact of stomach acid on the mucosal lining. This is accomplished with antacid chemicals or other agents that reduce acid production in the first place, either directly or indirectly. A range of plants can help here. These appear to work in a variety of ways via a multitude of mechanisms to facilitate a reversal of the condition. Peptic ulcers result from a breakdown of the lining of the stomach and duodenum. A number of possible factors may be implicated, including increased secretion of stomach acid and pepsin, and infection with the bacterium Helicobacter pylori. Duodenal ulcers are more common than gastric ulcers, which carry a greater risk of malignancy. Ulcers of either type may cause nausea, vomiting, loss of appetite, weight loss, and a gnawing, burning pain in the upper abdomen. It is now believed that most peptic ulcers are caused by infection with the bacterium Helicobacter pylori. However, some peptic ulcers are caused by prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, a group of pain relievers that includes aspirin, ibuprofen, and naproxen sodium. NSAIDs cause ulcers by impairing the stomach's ability to protect itself from acidic stomach juices. Normally, the stomach has three defenses against digestive juices. 1. Mucus coats the stomach lining and shields it from stomach acid. 2. The chemical bicarbonate, naturally present in the stomach, neutralizes stomach acid. And 3. Blood circulation to the stomach lining aids in cell renewal and repair. NSAIDs hinder all of these protective mechanisms. With the stomach's defenses down, digestive juices can damage the sensitive stomach lining and cause ulcers. Peptic ulcers usually have a chronic, recurrent course with a variable symptom picture. In fact, only about half of all ulcer patients present with the characteristic symptom picture. The pain is often described as burning, gnawing, or aching. There may also be a sore, empty feeling or a sensation of hunger. Antacids or milk will relieve the gastric pain. For duodenal ulcers, the typical pain is described as hunger pangs. For gastric ulcers, eating may bring on pain. Treatment of ulcers. Through the skilled use of plants with demulcent, antacid, astringent, and vulnerary actions, it is well within the bounds of therapeutic possibility to bring about a rapid and complete healing of any ulceration. Herbs such as Symphytum officinale, comfrey, Althea officinalis, marshmallow, Filipendula ulmaria, meadowsweet, Calendula officinalis, calendula, Matricaria recutita, chamomile, and Hydrastis canadensis, golden seal, are examples of remedies that may be used. Actions indicated: demulcents soothe the lining of the stomach, either by coating the stomach or exerting anti-inflammatory actions. Anti-inflammatories reduce localized mucosal reactions. Antimicrobials are indicated for dealing with Helicobacter pylori. However, these herbs must be active in the stomach in order for them to be effective. Astringents lessen local bleeding. Vulneraries speed natural wound healing. Carminatives will reduce any flatulence in the gastrointestinal tract. Nervines help ease background stress involvement. Bitters aid the healing process in the latter stages of treatment. Alteratives help the body deal with any systemic problems related to the disease. Caution: emergency hospitalization is essential if the ulcer perforates or hemorrhages. Specific remedies: Symphytum officinale, comfrey, Althea officinalis, marshmallow, Filipendula ulmaria, meadowsweet, Calendula officinalis, calendula, and Matricaria recutita, chamomile, can all be seen as possible specifics for the treatment of ulcers. Based upon an understanding of their actions, the rationale for the use of these herbs to treat ulcers is very predictable. Their content of anti-inflammatory flavonoids is thought to be very important to their activity. Glycyrrhiza glabra, licorice, is an effective remedy now used even in allopathic medicine as a treatment for ulcers. In addition to these herbs, raw cabbage juice is an effective traditional treatment. Similarly, demulcent foods such as plantain, banana, and even potato can help. As mentioned, newer research suggests that the bacterium Helicobacter pylori is implicated in the development of many gastric and duodenal ulcers. This may help explain why Hydrastis canadensis, golden seal, can be so effective against ulcers, even though digestive bitters are generally contraindicated in this condition due to the fact that they stimulate gastric secretions. Hydrastis is an effective antibacterial and may well be active against Helicobacter pylori. The successful use of herbs to treat peptic ulceration falls into two stages. The first step is to reduce inflammation and initiate healing, and the second is to tone and complete healing. The first prescription given here focuses on reducing inflammation and beginning the healing process. Prescription 1 for peptic ulcer: Symphytum officinale root, 1 part. Althea officinalis root, 1 part. Matricaria recutita, 1 part. Dosage: 5 milliliters of tincture combination 3 times a day. In addition, a cold infusion of these herbs, fresh or dried, may be drunk often to ease symptoms. Matricaria infusion drunk on an empty stomach will reduce inflammation and help reverse the ulcerative process. The next prescription focuses on the second step in the healing process. Prescription 2 for peptic ulcer: Hydrastis canadensis, 1 part. Symphytum officinale, 2 parts. Matricaria recutita, 2 parts. Dosage: 5 milliliters of tincture combination 3 times a day. Caution: if symptoms have not subsided within a week, seek skilled diagnosis. Table 13.8, actions supplied by peptic ulcer prescriptions. Action: demulcent, herbs, Symphytum officinale, Althea officinalis. Anti-inflammatory: Matricaria rickettita, Hydrastis canadensis. Astringent: Symphytum officinale, Hydrastis canadensis. Vulnerary: Symphytum officinale, Hydrastis canadensis, Matricaria rickettita. Nervine: Matricaria rickettita. Carminative: Matricaria rickettita. Bitter: Hydrastis canadensis. Broader context of treatment. Ulcer patients are vulnerable to many consequences of dietary abuse, as well as problems related to non-herbal treatments for peptic ulcer, such as antacids. Overuse of antacids can lead to impaired absorption of certain nutrients from the diet. Overconsumption of milk or antacids can elevate calcium levels in body tissues and urine, which can lead to kidney stones. A bland and milky diet may contribute to obesity. Milk can aggravate dietary sensitivity problems. Poor appetite associated with ulcers can lead to nutritional deficiencies. Dietary factors are fundamentally implicated in both the cause and the treatment of peptic ulceration. In some cases, ulceration may be due to a specific food allergy, but ulcers are always aggravated by sensitivity to irritants. As with other digestive system conditions, all irritant substances must be avoided, especially alcohol and tobacco. Pepper, coffee, and anything that the patient experiences as a problem should be eliminated. Avoiding aspirin and other NSAIDs is essential. Small meals often are tolerated better than large meals. Increasing the proportion of fiber in the diet has been shown to reduce the rate of recurrence of peptic ulceration. However, in the early stages of treatment, the patient should eat a bland diet to avoid physical irritation. Rest and reevaluation of lifestyle factors that may be causing stress are important. The creation of a stress management program uniquely suited to the needs of the patient should be a priority.